Hi, I'm Avi Gurwitz. I'm the medical director of the Pediatric UrgiCare clinic at Holy Redeemer Hospital. The most frequent question I get asked by parents is questions about fever, misunderstandings about fever. A fever is a common occurrence in children. It's an elevation in body temperature above the normal set point. And normal set point is between 97 and 99 degrees Fahrenheit. A temperature is a central temperature in the body above 100.4, and it can be as high as 100.5. A frequent question parents have is, what's the best way to measure a temperature? The worst way, I'll start with the worst way to measure a temperature, is feeling. A recent study showed that 60% of all parents who said they felt the temperature actually were wrong. When they actually took a temperature, there was no temperature. Now to the best way to measure a temperature. A temperature is a core temperature. It's basically the temperature inside the body. That's very difficult to measure. The two best ways to measure that is either an oral thermometer or a rectal thermometer. Fevers are never dangerous, ever dangerous. And I'm going to repeat that because it's important. A fever is never dangerous. Fever is a natural response. The body raises its temperature because of some stimulus, usually an infection. The body would never do something to itself that is harmful. So fever, as I reiterate, is not dangerous. It's never dangerous. It's what the fever is telling us that's important. There are certain situations where the fever in and of itself, even if a child looks well, can indicate a more serious medical condition. In particular, any baby under 2 months of age with a fever must be seen in the emergency room. Any child that looks ill with a fever must be evaluated. Any child with stiff neck, photophobia, which is light bothering the eyes, severe headache, must be evaluated with a fever. Anyone with a compromised immune system, that means if you're on long-term steroids, you have an immune problem, a child has cancer, anything that your physician has told you that your child is more at risk of a serious infection, fever can be the only sign that there's a serious infection. 101, 102, 105, it's the exact same thing to the body. The body doesn't raise a fever any higher because the infection is any more serious. It's a common misconception. People think, oh, the infection is really bad, the fever is 100.4. Adenovirus, which is a very common virus, gives you pink eye, gives you a fever of 100.5 fairly frequently. Meningitis, which is a lethal infection, can give you a fever of 100.1, 101. So it's important to know it's not the height of the fever. Once you have a fever, you have a fever. Another misconception is more fever means more Tylenol, more Motrin. Again, that is not true. An appropriate dose of Tylenol Motrin will always bring down a fever no matter how high it is. If your child looks sick, regardless of what the symptoms are, that could indicate a more serious infection. The caveat to that is all children look sick with a fever, and so it's important to bring the fever down. I'm not worried about a child that has 104 and looks sick as much as I'm worried about a child with 98 degrees and looks sick. That's a child that gets me very worried. If the fever makes him look sick but it comes down, that means the underlying illness isn't that bad. But if the fever comes down and they still look sick, that's very worrisome and they should seek immediate medical attention.